White House, Chestnut. How you doing? And one of the things that we offer is that we offer people wanting to get linking services too. This is my number. We do recruitment Monday and Tuesday. So Monday or Tuesday, contact me.
Opioid and other substance use disorders are consistently recognized as a brain disorder characterized by the loss of control, craving, continued use in spite of both physical, mental, and social problems. Long-term use is typically associated with increased involvement in the child welfare and justice systems. And in fact, during the course of the year, 1 in 4 people with opioid use disorder go through the justice system. Opioid use is one of the 10 leading causes of death, as well as one of the 10 leading causes of healthcare utilization costs. It is the only one of the 10 leading chronic conditions, however, that does not use a public health prevention model focused on early detection, intervention, and long-term monitoring.
We took that model of the chronic care model and applied it to developing recovery management checkups, that it would be an intervention that would be based on a long-term sustained contact to monitor and intervene when needed with people who have substance use disorders over time. And we have found that to be very successful in our prior studies. And in the current study, we're adapting it specifically for people with opioid use disorders who are leaving jail.
Cook County Jail is one of the largest in the country. It occupies over 90 acres in the surrounding Chicago area. People coming out of Cook County Jail face unemployment, lack of resources, mental health difficulties, lack of food, and also making sure that they continue on with medication, whether or not it's for mental health or whether or not for treatment of opioid dependence. Individuals that are readmitted into community, we're introducing them to our intervention, which is recovery management checkup. Want to make sure that if they're in need of additional treatment that they receive, and we can support that during their recovery phase. If they relapse, we will seek to see if they can get into treatment in a faster pace.
Recovery management checkups are one of the first interventions designed to adapt a public health approach to the long-term management of recovery, including motivational interviewing to help a person connect the dots and desire for change themselves, linkage assistance because they do face real barriers to going to treatment and staying in treatment. Could be housing, it could be transportation. And then because we're interested in this as long-term monitoring, we also want to stay connected with them and have a relationship where we come back every quarter or every month and stay in touch with them so that we can reinforce staying in treatment, or if they drop out, get them back into treatment, and if they're doing well, reinforce that.
Our current study is testing an adapted version that's been tailored to the needs of people with opioid use disorder. So the focus is on linking them to treatment with medications for opioid use disorder. Also, people who are immediately exiting from jail. So we understand the critical need of a very fast intervention. And then because of the high level of need and severity, the adapted intervention is testing this team-based model where we bring in more than one linkage manager to problem solve with the individual and provide that added level of support.
By increasing that treatment, we reduce substance use, and particularly opioid use and overdose, and also reduce long-term mortality. For a justice system study, this is also important because it reduces the likelihood of recidivism, because often people commit crimes either under the influence of substances or in order to get money to obtain them.
Family Guidance Center works very closely with the Lighthouse Institute, connecting patients struggling with OUD into treatment. Medication for opiate use disorder is one of the most effective evidence-based approach to treatment. Family Guidance Center provides medication-assisted treatment, which includes methadone, buprenorphine, and Vivitrol. The problem is that we've seen is that when a person gets out of jail, if they're not directly connected to treatment, you then disrupt their progress that they're making. We have 2 people that work in our outreach team who actually will approach people if they're interested, offer them, services. If they're interested in starting methadone, they will come into our van, and we have a nurse on the van who will do a quick questionnaire, reach out to our doctor who would ask a couple questions, and then be able to start them in treatment. We always have spots available. We're immediate access to care. So we will always be able to help you. There's never a wait list at our program.
The Justice Community Opioid Innovation Network is a large-scale national research network launched in 2019 by the National Institute on Drug Abuse to reimagine the way that the justice system responds to the overdose crisis. Chestnut Health System's Lighthouse Institute is running one of 13 large-scale clinical trials that's being supported through the J-Coin initiative. Chestnut has a really amazing team, and one of the most exciting aspects of their work is this close partnership between researchers and partners in the jail and in the community treatment settings. Importantly, this study is looking at both the public health outcomes like opioid use as well as public safety outcomes like reincarceration, and is looking at how much everything costs. What we hope is that this study will offer evidence about how well this adaptive version works. Assuming it does work, it will provide a critical tool not just in Chicago, but nationwide, that can support people in their recovery during this time that can be particularly challenging.